Goni scale ankle inversion tarsal joints. Position the patient sitting with the knees flexed to 90 degrees. Position the hip in 0 degrees of rotation, adduction, and abduction. In patient-appropriate language, ask the patient to invert the foot. Assess the tibia and fibula for knee extension and external rotation and abduction of the hip. Use one hand to push the forefoot downward into plantar flexion, medially into adduction, and turn the sole of the foot medially into supination to produce inversion. Stabilize the tibia and fibula to prevent knee extension and external rotation and abduction of the hip. The end of range of motion occurs when resistance is felt and additional motion causes external rotation of the hip. Assess the end feel of the joint. This should be firm because of the tension in the joint capsule, the anterior and posterior talofibular ligament, the calcaneofibular ligament, and various other ligaments of the foot. See your text for a complete list. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. The flexibility of a smaller plastic goniometer will make this measurement easier. Align the axis of the goniometer over the anterior aspect of the ankle, midway between the malleoli. Align the stationary arm with the anterior midline of the lower leg, using the tibial tuberosity for reference. Align the movable arm with the anterior midline of the second metatarsal. Ask the patient to perform inversion as previously done, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous motions of the hip and knee. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 35 degrees.